We have some health news this afternoon. We want to talk about a serious subject right now. It is National Suicide Week, Suicide Prevention Week. And Dr. Dave has been researching this, and you were telling me how many suicides a year?
34,000.
34,000.
Wow. Right. It is preventable. When the risk factors and the warning signs are detected early, lives can be saved. So we can go ahead and talk about what those risk factors are.
What are the signs we should look for?
The risk factors we want to be aware of is having depression, a mental disorder, substance abuse, or a prior suicide attempt, a family history of any of these things, violence in the family, or a major life stress such as a health problem, death of a spouse, or a move to a new area. And then we can recognize the warning signs by looking for the mnemonic, or remembering the mnemonic, is path warm. The I for ideation, talking about suicide, the S for substance abuse with drugs or alcohol, the P for purposelessness, not having an aim in life, the A for anger or rage, the T for feeling trapped in one's problems, the H for feeling hopeless about life, the W for withdrawing from friends, family, work, or school activities, the second A for anxiety, the R for recklessness, and high-risk activities, and the M for mood swings. And the third thing we want to do is to get help. If somebody is talking about suicide, you want to take them seriously. Do not leave them alone. Call their doctor. Call 911 or the National Lifeline, which is 1-800-273-TALK, and do not leave them unsupervised with firearms or medications.
Even if they're not talking about suicide, how do you know if it's at the point where you need to try to get them help?
Most people do have warning signs. There are a few people that do not, and it's just a matter of trying to talk about it if you're suspicious of that.
So if people get to the point where they're talking about it, you should listen. I mean,
absolutely, right. Yes.
Good advice, Doctor. Is path warm?
Is path warm?
And if you can't remember, I'm sure if you just Googled that, you can find all of those different
warning signs for suicide.
What it stands for. And again, 1-800-273-TALK is the National Suicide Lifeline. If there's a topic you would like Dr. Dave to address in one of our upcoming segments, email your questions to newsdesk@cbs47.tv.